Dear all, Namaskar. Good evening to everyone. We are meeting after a long time over a webinar session like this. I, Priyanka Sinha Roy, I will be your host for today's evening. And I have already shared with y'all the Facebook as well as the YouTube link. I would like y'all to please click on the link and go ahead to view the live session. Also, please share the same link with your friends, your colleagues, your family members all across so that they can also view the seminar. So let's get started. When we actually met with Dr. Chitra Ramamurthy, we just could not let her go away so easily because she is so experienced and such a wonderful human being. So let me introduce her a bit here, though I cannot tell much of because she has such an array of experience. But Dr. Chitra is MBBS MD, has done her diploma in reproductive medicine, the School of Medicine in Germany. She has a vast array of experience in various scopes of reproductive medicine. Right now, she's a senior consultant in Apollo Hospital. So today's topic is women's health in today's era. There is a saying that goes by which says, healthy women are the cornerstone of healthy societies. This is very true, and that is the reason we are going to discuss today our health issues in details across all ages and how to keep ourselves healthy and when exactly we need medical attention. We are extremely lucky to have Dr. Chitra, who took time out of her busy schedule to be with us. So before we start, we will be also taking questions at the end of the session for 5 minutes. You can type in YouTube chat or comment section or even in FB, that is Facebook comment sections too. I now hand over to Dr. Chitra for the session. Dr. Chitra.
Good evening, everybody. And thank you, Priyanka, for such a wonderful introduction you have given. Thank you very much. So, absence of a disease, the WHO says it is a state of complete physical, mental, and social well-being. Okay, next slide. I can't do no. Next. So today we are going to discuss about the health in women of all the ages. That is from adolescent to the menopausal women and postmenopausal. Next. In teenagers, there is not much of a problem, but they have to know about the menstrual hygiene, and the mothers should know about giving them the HPV, Tdap vaccination, and especially rubella vaccination is important. Then the puberty problems, like psychologically, they are like teenagers. They will be require some adjustment. They think that they are not even adult nor the child. So that age, the puberty problems should be addressed with the mother and the parents. And polycystic ovaries. Here I want to tell the polycystic ovaries, the hormonal changes is common at this age. Usually up to 5 years after the menarche, that is the first when they get their the menstruation, you need not worry about the polycystic ovaries. Next. Now coming to the child age group, that is, this is from around about 20 to 35, 40 years, where the patients with the woman will have lot of menstrual problems, and this is the time she plans about conceiving. That is the importance of preconceptional and the importance of the antenatal care. Then the fertility problems are rising nowadays, and she also wants to know about contraception. Next, when it comes to the menstrual disturbances, this is the most common problems with this age, and the most commonest being irregular menses. So, this is menstrual changes is always related to the hormonal release of the thyroid, adrenaline, pituitary, and hypothalamus. Next, next, the most commonest cause of irregular menstruation is PCO. Here, the polycystic ovaries are meant. Here, usually they'll have missed or irregular periods or the scanty flow of the menses when they put on lot of weight, especially onto the stomach. They'll have excessive body hair growth, yeah, including on the stomach, chest, and the back. Then the chances of developing acne, oily skin, lot of hair fall, and this is one of the most commonest cause for infertility. And pigmentation of the neck and underarms is very common. Next. So I always tell my patients the the treatment of polycystic ovaries is with you only. I tell them you have the treatment yourself. That is, change your lifestyle, change your diet, good exercise, and a good vitamins and a supplements will take care of the polycystic ovaries. Whatever that medications we give will not help if you are not putting your efforts. And second thing I want to stress here, polycystic ovaries will not disappear. So it is under control when you are doing a proper exercise and all. Okay. Next, the other problem what usually at this age they face is heavy menstrual bleeding. So we call it as a heavy menstrual bleeding. Earlier we used to call it as menorrhagia, and is diagnosed when the menstrual blood is considerably excess by the woman, which interferes with her physical, social, and emotional quality of life. So the causes, why do they have this heavy bleeding? It may be bleeding disorders, which is quite rare, but not always. It is not there or something. But when we don't find any other causes, we have to think about bleeding disorders. The other are due to the endometrial hyperplasia. This is due to the hormonal imbalance. Fibroids, adenomyosis, endometrial polyp. Endometrial polyp is the folding of the endometrium, or like a finger-like projections which will be in the lining. Endometrium means the lining of the uterus. Okay, and endometrial cancer and abnormal uterine bleeding. Next slide. So this is a slide showing what are the other causes of the this one menstrual bleeding. Next. So fibroids. Fibroids is a tumor in the uterus. It is not a cancerous. Very rarely it can change into cancerous. That is called sarcoma. Usually the fibroids need not be treated unless it causes any symptoms, or if it is too huge, or if it is coming in the way of the fertility. So what problems it can cause? It can cause painful menstruation, in between the menstruation. If it is grown into the uterus, it can have a bleeding in between the menstrual periods. Or if it is too big, it can press over the bladder, causing frequency of urination, or even sometimes retention of the urine. Next slide. So as I already said, all fibroids need not be treated. Only if it is causing the problem, or if it is too huge, it can sometimes cause a pressure over the ureter. That's a tube from the kidney to the bladder. In such cases, it can cause a retention of the urine reflex, causing the hydronephrosis. That is a urine collection in the kidney, I could say. So, or sometimes it can cause infertility, inability to for the couple, the lady to conceive. In such cases, we go with what is called the removal of the fibroid, which is called myomectomy. Or if she has finished the family, or if she is more than 40, 45 years, If she wants to have a permanent solution, then we will ask removal of the uterus, that is called hysterectomy. There are other alternatives methods like uterine artery embolization, and there were some cases where we used to do some medication. All those medicines have not been used because of its side effects on the liver and all those things. Next slide, please. Another thing is painful menstruation. As said, it is the most commonest cause is the endometriosis. Endometriosis means the presence of the endometrial cells other than in the lining of the uterus. What happens is during the menstruation, the lining of the uterus is shut out. So these cells, for some reason, can be present in the pelvis or in the ovaries or in the muscle of the uterus. So whenever the lady is menstruating, there is blood, she is bleeding in the ovaries or wherever the cells are present, which cannot come out. So there will be accumulation of blood there, causing severe pain during the menstruation. And it is also one of the commonest causes of infertility. So, to summarize, it causes painful menstruation, excessive bleeding, then it can cause painful intercourse, it can cause infertility, nausea, weakness, indigestion during the menstruation. Next. Adenomyosis is also a type of endometriosis where the lining of the uterine cells are present in the uterus. So that is in the muscle of the uterus, not in the lining, this one, ovaries also. It is usually associated with endometriosis outside also. Here also the patient will have the similar complaints how she feels in endometriosis. So both endometriosis, adenomyosis can be treated medically, but if the cyst, endometriotic cyst is very big, and sometimes we might have to do a laparoscopy and remove the cyst, and we give them some medications like injections like Lupride and all, GnRH injections, or a progesterone tablet to stop menstruating for few years so that the quality of the life is better because she will not get menstruation. Next slide, please. Coming to the preconception and all, I want to stress here the preconceptional test. See, before you plan for a pregnancy, it is important you go in for a preconceptional care, one or at least test 1 or 2 months before that, because it is going to reduce the risk of obstetric complication and improves the pregnancy outcome. What you have to do? You have to discuss with your doctor about any genetic histories you have and any medical problems you have. Say, for example, if you have diabetes, we want the diabetes to be under control before you plan for a pregnancy, because having a uncontrolled diabetes, you have more chances of abortion and abnormal fetus is there. So what we do is preconceptionally we do run through a blood test, that is your hemoglobin and hemoglobin electrophoresis to rule out hemoglobinopathies like thalassemia and all. Then we do your thyroid, and we do your this one rubella. Rubella is a type of viral infection. If it comes during pregnancy, it can affect the child. That is, it can even go into the extent of causing blindness and all. So we routinely do IgG. IgG is the old infection. So if IgG is positive, that means the patient is immunized. So you can go ahead with the pregnancy. If it is negative, we usually advise her to go in for a vaccination before she plans for the pregnancy. Same way, varicella, chicken pox. Chicken pox, if it comes, most of our Indian women would have exposed to a chicken pox. So if it comes during the pregnancy, it can also affect the child. So if she's already had a chicken pox, you get the lifelong immunity. So you need not have to do any test or something. Otherwise, if you're not immunized, it is better to take vaccination before you plan for the pregnancy. Next slide, please. So there comes the antenatal case. Once you become pregnant, you have to go for an antenatal checkups or antenatal care. So antenatal care is the health care given to the pregnant woman from the onset of pregnancy till the time of delivery. What we check her hemoglobin, we check her height, and we just do a series of scan to know that her baby is doing fine. So she is doing fine. So it is very important to start the antenatal checkup as early as 2 months pregnant. Next slide. The other commonest common this is problem the reproductive age group of facing is infertility. There is a steady rise in the infertility cases in India that may be because of the stress or the people are getting married late. By then, they are quite pretty late, so that they have to hurry up. Or because of the profession, we try to, want to settle in the profession first. By then, you are running late. So these are the few cases, the causes of infertility. So, what we advise you, the couple, is to stop smoking, stop alcohol when you are planning for the pregnancy, when you come for the fertility treatment. Next slide. So, PCO, I have already said it is one of the commonest cause for infertility. That is because the polycystic ovaries means the follicles which are supposed to develop and release the egg is not happening. So the most this one can be treated with medications like ovulation induction drugs. Next slide. So infertility, to summarize, is a significant social and medical problem affecting the couple worldwide. So I want to stress here that both male and female factors are equally responsible, and evaluation of both is very, very important. So when we call for an infertility counseling or testing, I always tell you have both of you have to come, not with your mother or mother-in-law. And it is important you come with your husband. So the treatment depends on the cause of the infertility. It may be from the ovulation induction or to the surgery or to ART, this one assisted reproductive techniques, which is IUI, IVF, etc. Next. Lastly, this is the time she would have finished the family. She doesn't want it. And comes with the pregnancy, wants to go for termination, that is MTP and all. Instead of that, it is better to go for a proper contraception. So we have the contraception is natural planning methods like taking precautions during the fertile period or the barrier method. We get hormonal tablets like oral contraceptives, IUCDs, hormonal IUCDs like Mirena, or even IUCD, copper T, multi-load can be used. I want to stress a little bit about emergency contraception. I just want to tell that people think this emergency contraception is a contraceptive pill. No, it will protect only one that act, and it has to be taken within 72 hours of unprotected sex. And because of this, you might have a withdrawal bleeding in between your cycle. Okay, next slide. The permanent methods of contraception are tubal ligation, that is PRECONCEPTION, or
Ma'am, we are stuck here a little bit. Can you please repeat? Your video and audio is stuck. Ma'am, can you hear me? Doctor? I think there has been a little bit of a problem from the doctor's end, so she is reconnecting back. Let's give us let's give her a few seconds. I think she's back. Yes, we lost you
Yeah.
for some time, doctor. So if you can just repeat on this slide,
Okay.
that would be great. Thank you.
Yeah, these are the permanent methods of contraception. That is for female. It is called 1 minute. Where is that? Okay. No, I'm kidding. Go ahead with the vasectomy in male. So it can be, sorry, tubal ligation can be of two methods. One is open method, another two is laparoscopy, which can be done within 10th day of the period. She need not conceive and come also. And she can come in the morning and go back in the evening. Vasectomy is much simpler and it is done in male. Next slide, please. This abnormal uterine bleeding, it is most of it has been already talked in when I was talking about heavy menstrual flow. But here the changes may be in the flow. That is, that she might have only 2 or 3 days of the bleeding, which may be heavy, or the duration of the bleeding may be long, like more than 7 days, or she might be bleeding once in 15 days, or in between the cycles. The causes are already have told. It may be a fibroid, it may be due to a polyp, it may be due to a cancerous, or it may be due to the drugs. Sometimes they take hormonal tablets and suddenly stop it, then you can have bleeding in between the menstrual cycle. Next week. Then now coming to menopausal age group and postmenopausal ladies. The menopausal symptoms I really have to stress here because this is very, very important, not only because the woman is the one who suffers, not only her, but also her family members also suffer due to this menopausal symptoms. Next. The symptoms, next. The symptoms might vary from so many things. She might have hot flushes, she might get depressed, she might feel like crying without any reason, she will have no sleep, that is insomnia, and even in sexual life, she loses her interest and it will be painful. The urinary symptoms becomes more, she have urge incontinence, like by the time she goes into the bathroom, she leaks little bit and she'll have weight gain and palpitation, mood swings, don't tell me, and joint pain and all those things. Next slide. Then comes post-menopause 60 and beyond. This is important for you people to do exercise, healthy diet, and weight management. They have high risk of heart disease, genital tract cancers, breast cancer is highest. They also have what is called as the benign causes like uterine prolapse, vaginal prolapse, osteoarthritis are very common at this age. Next slide. Now coming to the cancerous, this one, the breast cancer is quite common nowadays. Here, the patient will have if she can feel some lump in her breast, pain, or she can feel that nipple is retracted, it looks something different, and there might be discharge through the nipple. One breast is more than bigger than the other. There is a skin changes like dimpling of the skin. Next slide. The screening is important. We advise mammogram when you're above menopausal or perimenopausal or younger age group. We can ask for a sonomammogram. But the important step tell is the self-examination. You have to stand in front of the mirror, see the breast. Is there any discharge? Is the nipple is retracted? Is there any change in the skin? And then you have to see any this one lump if you have to feel. This examination is very important. See, you have to put your left hand if you are examining the right breast. So you put your left hand on the waist. With your right hand, you have to make a circular movements on the breast. If you try to hold the breast like this, you will definitely feel the mark. When you feel the circular movement, if you feel a mark, you have to meet the doctor immediately, whatever age it is. And breast cancer is one of the cancer which can run in the families also. Next slide, please. Cervical cancer. Cervix is the mouth of the uterus, we call it as. It is, if you diagnose the cervical cancer early, it can be cured. So, what is the screening test we ask is the pap smear. We take a smear from the mouth of the cervix and see for that any changes in the cells, malignant changes in the cells. Next slide, please. So when do you do? Once the lady girl is sexually active, you have to start doing the pap smear. Usually we tell once in 3 years if the normal results and normal results are found, and after three successively it is normal. Once in 5 years should be sufficient. But if it is abnormal, please repeat it once in 6 months or 12 months. The other thing I want to tell is a HPV screening test. That is, HPV infection could be one of the commonest cause for cancer of the cervix. So we do what is called the HPV screening also. It is also done like what we do the pap smear. So it is, we have got vaccination which can be given to the girls. So it is ideally given to the girls before she becomes sexually active. There are two doses given over three doses, sorry, over 6 months of time. That is, one is given between 0, 1, 6. The other one is given 0, 2, and 6. And it is also advised the same thing for the boys also. But here I want to give one warning that just because you have taken a HPV vaccine, it doesn't mean that you should not go for a pap smear. Pap smear is essential because there are other causes of cancer of the cervix, not only the HPV infection. Next slide. Then the body of that is a uterine cancer that is from the body. It is usually seen over postmenopausal ladies. That means postmenopausal means the lady who has stopped menstruating at least for 1 year. The commonest cause they come is the bleeding, or sometimes a routine ultrasound when they go for health check and all, they find the uterus lining is thick. So how do you diagnose it? The ideal is by doing a pelvic examination, of course, if the uterus has not shrunk, that is, it is still bulky in a postmenopausal lady. Usually, what happens is once you attain menopause, due to the hormonal deficiency and all, your uterus will try to shrink. So, if it has not happened, that is, you have to think of a uterine cancer. Second thing is routine ultrasound. Especially, we tell the transvaginal ultrasound to see the thickness of the endometrium, that is the lining of the uterus. It should be less than 5 mm. If it is more than that, it is better to do a what is called a pupil biopsy to rule out the malignancy. The other ways is doing a hysteroscope, taking a biopsy and all. Then we go ahead with the MRI and all, that is later. There's a ovarian cancer. Ovarian cancer is another difficult cancer to be detected because most of the time the patient may be unaware of the swelling in the uterus, I mean the ovaries. So here the patient usually comes with the, as I said, the postmenopausal bleeding if the tumor is hormone producing, or she can come with the pain abdomen, or it is due to the swelling in the lower abdomen, or she might feel a mass. So if early detection, it is very important to treat that. So what we do is some tumor markers, ovarian tumor markers, detect this. Here also I want to stress that ovarian cancer can be familial. And if you have a family history, it is better to do a family history of ovarian cancer, we usually advise the siblings or the daughters to go ahead with the removal of the uterus with the tubes and the ovary in a later age group, maybe 48, 50 years. Even if she doesn't have symptoms, it's better to go for a removal of the uterus. Next. Colonic cancer, I'm not a very good expert in this, but it is also familiar. The otherwise, it usually diagnosed with a colonoscopy or a scan or stool examination. Next, postmenopausal lady. I already said it is a permanent state that lasts for rest of your life after the 1 year after stopping the menstruation. Here we have causes of arthritis, osteoporosis, and I said prolapse. Prolapse is where the uterus comes down from its normal position. It comes out of the vagina. It is due to the, I don't have the slide, I just want to tell about it, because it is due to the hormonal deficiency. Sometimes it can occur otherwise also due to the difficult deliveries, normal deliveries we used to do, instrumental deliveries, especially forceps deliveries and all, were due to the causing the trauma to the ligamental support of the uterus. So these the ideal is not only the uterus come down, it brings down the bladder and also the rectum posteriorly, I mean at the back. So what we usually do is we take out the uterus, push the bladder back, rectum back, and suture. So there is alternative like pessary and all, which is not of much help, I would say. Next slide. So osteoporosis is very important. I said because the bones becomes very weak as we grow older. So bone density measurement is important. Next. So how do you treat this one osteoporosis with vitamin calcium and vitamin D supplements? I would like to stress here the calcium and vitamin D should be taken not only when you get menopause or perimenopausal age only by taking it every lady, it prevents the osteoporosis to certain extent. Next slide, please. So here I want to stress that no matter what stage you are in, eat healthy, be happy, manage the stress, and take the supplement wisely. Thank you very much. And I also want to have a special thanks to Barsha Bengali Association for giving me such a opportunity. And thank you once again, Priyanka.
Thank you so much. Thank you so much, ma'am, to take out again. I'm repeating to take out time from your busy schedule to come here and be with us. And it was an eye-opening session today. And I have a lot of friends and people who have personally given me quite a few questions over here. So if it is okay, can we take up a few questions, ma'am? Ma'am, I cannot hear you. You're muted. Tell me. Take your time, ma'am.
Okay, okay. Yes, go ahead.
Yes. So, one of the things that most of the, our mother group as well as their kids who are in teenagers and, they are 18 years or going to 20 or so we all have faced even after marriage when we were teens this menstrual pain, and we have been using medicines.
Priyanka, I
So,
can't listen your voice.
okay. I'm saying that in various age groups, like say for example, ma'am, teenagers to mothers to a little older also group, some of us we suffer from menstrual pain throughout our whole cycle. Okay, and for that we usually take medicines to suppress the pain. So, how good is it? I mean, these are normal cramps, but then in order to work and everything, we need to take so that, we can be, like working for the whole day and all these stuff. So, is it good to take these medicines? Like we are used to these medicines a lot.
See,
See,
I'm sorry,
I'm
I forgot
sorry,
to
I forgot
mention
to
this. It's
mention
a
this.
plain
It's a plain
menstruation is
menstruation is
very
very
common. We
common.
usually
We
tell the
usually
girls,
tell the
so
girls,
you
so
once
you
you get
once you
married,
get
your pain
married,
will
your
go
pain
off.
will go off.
And
It
sometimes it
doesn't
Sometimes
happen.
it
passes.
will pass
And
it.
they say
And
once
they
you
say once
deliver,
you
your pain
deliver,
will
your
go off.
pain will go
For
off.
some people,
For
it
some people,
still passes.
it passes.
She goes into
She goes into
menopause.
menopause.
Yeah,
So
actually.
antispasmodic is
Antispasmodic
okay,
is
but
okay, but
whenever you take
whenever you take
analgesic, you should be
analgesic, you should
careful
be careful
because some
because some
analgesic can
analgesics
be
can be
affecting
affecting
the
the
kidneys and all.
kidneys and all.
Okay. So, another related question to this medicine only, since I have asked that one, I will just ask this that sometimes, like we usually all my friends and colleagues and whoever has written over here, they always say that there is a heavy flow. Okay, unlike most of the people. So, there is a pause medicine that is usually used. So, is it good to use that pause to regularize or what do you think?
Symptomatic
Symptomatic
treatment for heavy
treatment for heavy
menstruation.
menstruation.
It
Okay.
controls
It
the
controls
bleeding.
the bleeding.
It doesn't
Okay.
give a
Doesn't give a
permanent
permanent
solution. So
solution.
we have to
So we have to
evaluate why it
evaluate
is
why
causing.
it is causing.
Okay. Thank you.
There is no
There
problem
is
with
no
taking
problem with
pause. Up
taking
to
pause
3
up
per
to
day,
3
up to
per day,
5 days
up
you
to
can
5
take.
days you can take.
If it is
If it is
associated with
associated with
pain, we
pain,
tell
we
to
tell
take
to
MF.
take MF.
The plain
The
pause
plain
should be
pause
sufficient.
should be sufficient.
Another thing is that one of the person is asking that removal of one fallopian tube, okay, due to fibroid or whatever, after removal also, like the menstruation flow is remaining normal with her, and will it go on till menopause? There shouldn't be any irregularities. That is normal, right? Because
See,
See,
the removal
the
of the
removal
tube
of the tube
is usually
is
done
usually done
whenever we have
whenever we
PCOS
have
for the
yes
tubal
for tubal
pregnancy,
pregnancy
or
or
sometimes when
sometimes
we are
when we are
achieving infertility, there
infertility,
might be
there might
collection
be
in the tube
collection
called
that you call
hydrotherapy.
hydrotherapy.
So tube
So
does
tube
not
does not
play a
play
role
a
in
role in
menstruation.
menstruation.
It is
It is
function is
function
for
is
the egg
for
and
the egg
sperm
and
to
sperm to
unite. It
unite.
unites
It
in the
unites
tube
in the
and
tube
then comes
and
into
then
the
comes
uterus
into
to
the
get
uterus to
implant.
get
So
implanted.
it is has
So
a
it is
role
has
in
a role in
fertilization,
fertilization,
in fertility part of it.
fertility part
It
of it.
does
no,
not
It
cause
does
any
not cause
menstrual
any
problem.
menstrual problem.
I think she is mentioning over here that one of the ovary itself is removed on from one side.
Ovary is removed
Ovary is
also.
removed
It is
also. It
okay.
is
You
okay.
can have
You
the
can have
functional
the
ovarian
functional ovarian
hormonal
hormonal
this one to the
this one
other
to the
ovaries.
other ovaries.
So one is sufficient.
One is
One is
sufficient, but
sufficient, but
usually we don't
usually we
try to
don't
take
try
out
to
the
take out the
ovaries
ovaries
in
in
younger age.
younger age.
Okay. Another question is over here that in between menstrual cycles, some people suffer from extreme menstrual pain. Now, why does that happen? I mean, the date is also not there, but still, that pain suddenly comes. Should we look for medical attention at this stage? What should we do?
Most commonest
Commonest
cause for this
cause for this
pain in between
pain
the
in between the
menstruation is
menstruation is
ovulation pain.
ovulation pain.
Some people get
Some
a
people get
severe
a
pain
severe
during
pain during
ovulation.
ovulation.
So I don't
So
think you
I
should
don't
worry
think you
about
should
it.
worry about it.
Okay. And you were talking about menopause, ma'am. So menopause, does it have anything to do with the heredity? Like your mother has stopped for a long age, then you also carry on like that.
Right. Whenever
Right.
we
Whenever
come with
we
a
come with a
lady who
lady
has a
who
mother
has a
who got a
mother who got
menopause
a
early,
menopause
she
early,
also
she
has a
also has
chances
a
of getting
chances of
menopause
getting
early.
menopause early.
So
So
usually we always
usually we
ask,
always
what
ask,
age did your
what age
mother
did
go
your
into
mother go into
menopause?
menopause?
Yes, yes. Okay. And one very crucial question is like, since we have a lot of age group above 40. So in case there is a conception above 40, say 45, 42, whatever, I mean above
Priyanka, I
40.
couldn't hear you. Your voice is breaking.
I'm saying that in case there is, since our age, most of the age group is like above 40. Okay, so we want to know that above 40, if there is a conception, like
Huh?
you conceive after 40.
Okay.
Say, even towards the late 40s or something. So, do we need to take extra precautions in the case of the baby or the mother?
No,
What
your voice
complications
is,
can?
I think you are
I'm saying
asking.
what complications it will arise if it is a late pregnancy. I'm saying.
Okay. Oh, late pregnancy. Late pregnancy, especially after the 40 years, the chances, what is called as a Down syndrome, that is a genetic disorder where the baby is a mentally challenged, is very high. So there are some tests what we do in a pregnant lady, like
Mm-hmm.
non-invasive, like NIPT is there, double marker is there, or if you have a doubt, it's better to do amniocentesis, where we take out the fluids from the around the womb and test it for genetics.
I think that covers most of the things over here. There has been a lot of repeat questions also. So I think I have mostly covered, except some people over here are saying that exercise, like if you cannot do exercise because of work and, looking after the kids or home or whatever it is. So how will it affect? Because most of us, we are like all into work and we are not able to get up in the morning, because getting up in the morning is to, dress our kids and send them off to school. It becomes very difficult, and, you are not charged enough to do it. So this, like how we can, balance this thing. Is it healthy diet, or is it very
No, I
important to
think
do
exercise
exercise?
is important thing. Though I'm preaching, I know it is very difficult. So it is not doesn't mean that you have to get up in the morning and do the walking. I always tell just a walk 10 minutes after each meal is very, very, or in between your work, 10 minutes. When you're going
Yeah.
for a shopping, don't go in the car. Go walk down or cycle yourself to the shopping. Something like that we have to do. At least twice or thrice a week, we have to do something to make
Yes,
ourselves,
something we need
fit.
to do, right, right. Okay, ma'am. I think we have covered mostly everything, and it has been quite a long session of 46 minutes of your time, which we really, really appreciate. And, um, we hope to have a long term relationship with you, ma'am, so that you can again come back, especially when we have, during COVID session, COVID times, we had a lot of webinars like this, and hopefully next time, we can call you in person and we can, have a talk, during our
Yeah,
puja times and all. So
that
we
will be
are
very nice. I'll be
yes,
happy
yes,
to come.
that is what I'm looking forward for, that this year coming puja, maybe we will have something with Apollo Clinic where you can come down, help us with all the things, because puja is also a very lady oriented thing, and we are all ladies who are like very, very excited to meet and get inspired from a personality like you. Thank you so much for coming. Hopefully, everyone has benefited from this eye opening session. And there were so many things which even we didn't know, we came to know, and scientifically we came to know, because, we always try our old school. Mother told us this. Mother-in-law told us this. So it every time does not happen, and
That is very important.
that is very, very important, and
Yeah,
we should be able to give the same knowledge to our daughters, who are also growing up. They are in their teens, and we would love to support them in a much more scientific way, rather than, the way we used to do it. So thank you so much, doctor, and hopefully we will see you again very, very soon, and we'll connect with you. Thank you so much, Dr. Ranjita. Also, thank you so much for your help. Okay, the whole team has worked very well. Can I see you, Dr. Ranjita? Show me Your face, ma'am. Yes, this is Dr. Ranjita. Thank you for a wonderful session. I hope you people did not have much problem with this streaming platform. It was something new. We tried. So thank you so much from all of us from Barsha. Hope to see you soon. Thank you.
Thank you.
Thank you.
Thank you.
You can
Thank you.
leave the studio. Thank you.
Okay, ma'am.